What if the very first signs of diabetes didn't show up in a test result, but in something you've been feeling every day and brushing off? Not pain that stops you, not something dramatic, just small changes in your feet, a little numbness when you wake up, a strange tingling at night, skin that feels drier than it used to. Things most people don't even think twice about. In my experience, that's exactly how it starts. I can't tell you how many times I've had a patient sit across from me, completely unaware that their body had already been sending quiet warnings for months, sometimes even years. In fact, not long ago, I saw a woman in her early 70s. She came in for a routine visit, nothing urgent, just a checkup. As we talked, she mentioned almost in passing, "My feet have been feeling a bit off lately, kind of tingly sometimes, but I assumed it was just circulation or age." She wasn't worried, but I was paying attention, because I've learned over the years that when the feet start changing, it's often not random. So we looked a little deeper, and when her results came back, her blood sugar was already elevated, well into the diabetic range. What struck me wasn't just the diagnosis, it was how clearly her body had been trying to signal it long before that moment. You see, most people believe diabetes shows up suddenly, after a test, after a diagnosis. But clinically, that's not what we see. What we see is a slow, quiet process, where rising blood sugar begins to affect your nerves and your circulation, like wear and tear on electrical wiring and narrowing pipes. And the feet, being the farthest point from the heart, are often the first place those changes begin to show. The problem is, these early signs don't feel urgent. They feel normal. They feel like aging, and that's why they get missed. So today, I want to walk you through something very important. 9 warning signs in your feet that could be signaling diabetes. Signs that many older adults notice, but almost nobody connects to what's really happening inside the body. I want you to pay close attention to this, because once you understand what your body is trying to tell you, you have a real chance to catch this early, protect your health, and avoid the complications that so many people only discover when it's much harder to turn things around. Before we go any further, I'd like to ask you something simple but important. How old are you? And have you noticed any changes in your feet lately? Maybe it's something small, a little tingling, dry skin that wasn't there before, feet that feel colder, or even a bit numb at times. If any of that sounds familiar, go ahead and share it in the comments. You don't have to explain everything, just a few words is enough. Because what I've found over the years is this: when people start noticing these patterns in themselves, it becomes much easier to connect the dots and take action early when it matters most. And as you listen to the rest of this, I want you to keep your own experience in mind, because some of these signs may already be happening quietly without you realizing what they mean. Let's start with a sign that almost everyone overlooks: dry, cracked skin on the feet that just doesn't seem to improve. Now, most people assume this is harmless. They think it's the weather, aging, maybe just not using enough lotion. And to be fair, dry skin is common as we get older. But here's what many people don't realize. When dryness becomes persistent, when the skin starts to crack, peel, or heal very slowly, that can be an early signal that something deeper is happening inside the body. You see, healthy skin depends on good circulation and proper hydration at a cellular level. But when blood sugar is elevated over time, it begins to affect the tiny blood vessels that nourish your skin. Think of it like soil that's no longer getting enough water. At first, it just looks dry, but over time, it begins to crack. And those cracks are more than a cosmetic issue. They create small openings, entry points for bacteria. And in people with rising blood sugar, the body's ability to heal those small breaks is often slower than it should be. So what you're left with is skin that not only breaks down more easily, but struggles to repair itself. If you've noticed that your feet feel rougher than they used to, or small cracks seem to linger longer than expected, I don't want you to ignore that. Simple daily care, like moisturizing, checking your feet regularly, and staying aware of your blood sugar, can make a meaningful difference. because catching something small like this early can prevent something much bigger later. Now, here's another sign that many older adults mention, but rarely connect to something deeper. Feet that feel cold most of the time. Not just when the room is cold, not just in winter, but a persistent chill that doesn't quite match your surroundings. You may even find yourself wearing socks to bed, or trying to warm your feet, only to notice they never quite feel normal. Most people assume this is just poor circulation or getting older. But let me explain why that matters more than you might think. When blood sugar stays elevated over time, it begins to affect your blood vessels, especially the smaller ones that carry blood all the way down to your feet. Think of those vessels like narrow pipes. When everything is working well, blood flows smoothly, delivering warmth and oxygen. But when those pipes start to stiffen or narrow, that flow becomes restricted. And your feet, being the farthest point from your heart, are often the first place you feel that change. That persistent cold sensation is often your body's way of telling you that circulation is not as strong as it used to be. And over time, reduced blood flow doesn't just affect temperature. It affects healing, sensation, and overall foot health. If this has been happening to you, even occasionally, I want you to pay attention to it. Simple habits like gentle daily movement, keeping your feet warm, and monitoring your overall health, especially your blood sugar, can help support better circulation. Because something that feels as small as cold feet can actually be an early signal worth listening to. Now here's a sign that often confuses people, because it seems to contradict what we just talked about. Instead of cold feet, you may notice the opposite, a burning sensation, or unusual warmth in your feet, especially at night. Some people describe it as a dull heat. Others say it feels like their feet are on fire under the blankets, even when the room is cool. And it often shows up when you're trying to rest. Now you may be thinking, how can my feet feel cold sometimes and burn at other times? That's actually a very important clue, because what this usually points to is not just circulation, but early nerve irritation. Let me explain it simply. Your nerves work like electrical wiring, carrying signals between your brain and your body. When blood sugar stays elevated over time, it can begin to damage those tiny nerve fibers. At first, the damage is subtle. Instead of losing sensation right away, the nerves start to misfire. Like faulty wiring sending the wrong signals at the wrong time. So your brain may interpret those signals as heat, burning, or discomfort, even when there's no external cause. And here's what I often see in older patients. This sensation becomes more noticeable at night, when everything is quiet and your body is at rest. If this has been happening to you, I don't want you to brush it off. Because this stage is often early, and that means it's a window of opportunity. Paying attention now and getting your blood sugar checked if needed can make a real difference before that irritation turns into something more permanent. Now here's a sensation many people recognize immediately, but almost never take seriously enough. That pins and needles feeling. A light tingling in the feet, almost like your foot has fallen asleep and is slowly waking back up. At first, it may come and go. You might notice it after sitting for a while, or when you're lying in bed at night. And because it doesn't last, most people ignore it. They shake it off, move their feet a little, and assume it's nothing. But this is where I want you to pay very close attention. Because tingling is often one of the earliest signs that your nerves are under stress. Remember what we talked about earlier. Your nerves are like electrical wiring. When blood sugar stays elevated even slightly over time, it begins to irritate those delicate nerve endings. Not enough to shut them down, but enough to disrupt the signal. So instead of a clear, normal sensation, you start to feel these abnormal signals, tingling, buzzing, or that pins and needles effect. And here's what I often see clinically. At first, it's occasional. Then it becomes more frequent. And over time, if the underlying cause isn't addressed, it can progress into numbness. If this has been happening to you, even mildly, I don't want you to dismiss it as just poor circulation or sitting too long. Your body may be giving you an early warning, and the earlier you recognize that signal, the more control you have to protect your nerves before the damage becomes harder to reverse. Now, this next sign is one I take very seriously in my patients. Cuts, blisters, or sores on the feet that take longer than expected to heal. At first, it may seem minor. You bump your foot, get a small crack in the skin, maybe a blister from a shoe. Normally, these things should start improving within a few days. But if you've noticed that even small wounds seem to linger, or take weeks instead of days to heal, I want you to pay close attention to that. Because healing is one of the clearest windows into how well your body is functioning internally. When blood sugar is elevated, two important things begin to happen. First, circulation becomes less efficient, so the area doesn't get the oxygen and nutrients it needs to repair itself. Second, your immune response becomes slower and less effective. Think of it like trying to repair a road. Without enough workers or materials getting to the site, the job gets delayed. And during that delay, bacteria have more time to settle in. That's why even small cuts on the feet can sometimes turn into infections if they're not healing properly. And in more advanced cases, this is how ulcers begin. Now, I don't say this to alarm you, but to help you recognize how important this sign is. If you notice slow healing, don't ignore it. Clean and protect the area, check your feet daily, and most importantly, have your blood sugar evaluated if this is happening repeatedly. Because something small on the surface can be a signal of something much deeper underneath. Before we go any further, let me pause with you for just a moment. If what you're hearing is starting to connect some dots for you, if you're recognizing even one or two of these signs in your own feet, I want you to take a second and let me know. You can simply type "yes" in the comments, or mention which one you've noticed. Because many people don't realize this until they hear it explained clearly. And when you share it, it often helps someone else recognize it in themselves too. And if you're finding this helpful so far, go ahead and tap the like button. Not for me, but because it helps this kind of information reach more people your age who may be going through the same thing, quietly, without understanding what their body is trying to tell them. Now, let's continue, because the next few signs are even more important, and often more serious if they're ignored. Now here's a sign that you can actually see with your own eyes, if you know what to look for. Changes in the color of your skin, especially in your toes or the bottom of your feet. Maybe they look a little more red than usual, sometimes slightly bluish, or even darker in certain areas, almost like a shadow under the skin. Most people don't think much of it. They assume it's pressure, maybe tight shoes, or just circulation acting up for the day. But here's what I want you to understand. Healthy skin color depends on healthy blood flow. When oxygen-rich blood is moving properly, your skin has a natural, even tone. But when that flow becomes disrupted, when blood vessels are affected by elevated sugar levels, the color can start to change. Think of it like traffic slowing down on a busy road. At first, it's subtle. But as the flow becomes more restricted, things begin to back up, and that shows on the surface. Redness can be a sign of inflammation. Bluish tones can suggest reduced oxygen. And darkening in certain spots may indicate areas under stress or not getting enough circulation. In my experience, this is often overlooked until it becomes more pronounced. But if you've noticed unusual color changes in your feet, even occasionally, I don't want you to ignore that. Check your feet regularly, especially the soles and between your toes, and bring it to your doctor's attention if something doesn't look right. Because your skin is often reflecting what's happening beneath it, long before you feel it. Now we come to a sign that is much more serious, and often much more dangerous than people realize. Loss of sensation, numbness in the feet. At first it may feel subtle. You might notice your feet don't respond the same way when you touch them. Or that familiar sensations, like the texture of the floor or the feeling of your shoes, just aren't as clear as they used to be. Some people describe it as if they're wearing thick socks, even when they're barefoot. Now here's the part many older adults miss. This doesn't usually happen suddenly. It often begins with the tingling we talked about earlier, those small, intermittent signals. But over time, as the nerves become more affected, those signals don't just get distorted, they start to fade. Think of it like a dimming light. At first, it flickers, then it grows weaker, and eventually parts of it go out completely. That's what's happening with the nerve signals in your feet. And the real concern here is not just the numbness itself. It's what you can no longer feel. A small cut, a blister, even something sharp under your foot. Without sensation, those injuries can go unnoticed and untreated. And that's where complications begin. If you've noticed any loss of feeling in your feet, even slightly, please don't ignore it. This is something we take very seriously clinically, because protecting your sensation means protecting your balance, your safety, and your independence. Now, this next sign is one that many people experience, but very few understand what it really means. Pain in your feet, or sometimes your calves when you're walking, that improves when you stop and rest. At first, it may feel like simple fatigue. You're walking to the mailbox, around the store, or down the street, and a discomfort starts to build. Not sharp, not sudden, but enough to make you slow down or stop. Then you pause for a minute, and it eases. So naturally, most people think, I just overdid it. But here's what I want you to understand. This pattern, pain with movement, relief with rest, is often a sign that your muscles are not getting enough blood flow when they need it most. Think of it like traffic on a busy road. When you're at rest, everything moves fine. But as soon as demand increases, like when you start walking, the flow can't keep up. And that's when discomfort shows up. In medical terms, we often associate this with reduced circulation in the arteries, something that can be linked to long-term effects of elevated blood sugar. Over time, those blood vessels can narrow and stiffen, limiting how much oxygen reaches your muscles during activity. If this has been happening to you, even occasionally, I don't want you to dismiss it as just aging or being out of shape. Your body may be signaling that circulation needs attention, and catching that early can make a very real difference in how well you move and how safely you stay active. Now we come to the final sign, and in many ways, one of the most revealing. Frequent infections in the feet or noticeable changes in your toenails. This might look like nails becoming thicker, more brittle, or discolored. A yellowish tone, maybe even a slight odor. Or recurring issues like athlete's foot or fungal infections that keep coming back, no matter what you try. Most people see this as a surface problem, something cosmetic, something minor. But here's what I want you to understand. This is often one of the earliest visible signs that something deeper is out of balance. Because when blood sugar levels are elevated, even slightly over time, it creates an environment where bacteria and fungi thrive. Think of it like excess sugar acting as fuel. At the same time, your immune system, the part of your body that fights off infections, doesn't respond as efficiently as it should. So now you have two things happening at once: more opportunity for infection and less ability to fight it off. That's why these issues don't just appear, they persist. In my experience, this is often one of the first signs people notice, but rarely connect to blood sugar. If you've been dealing with recurring foot infections or changes in your nails that don't improve, please don't ignore that. Because your body may be giving you a very early, very visible signal. And recognizing it now could help you catch something early before it begins to affect your nerves, your circulation, and your long-term health. Now, I want you to take a step back with me for a moment and look at the bigger picture, because what we've just gone through, these 9 signs, they are not random. They are not separate problems happening by coincidence. They are connected. And here's the part many people never hear explained clearly. All of these signs, dry skin, tingling, numbness, slow healing, color changes, pain, infections. They all point back to one underlying issue: your blood sugar quietly affecting your nerves and your circulation over time. Think of it like this. Your nerves are the communication system. Your blood vessels are the delivery system. And when blood sugar stays elevated, even slightly, it begins to interfere with both. The signals get weaker, the flow gets slower. And because your feet are the farthest point from the heart, they're often the first place this shows up. Not with a loud warning, but with small, easy-to-ignore changes. And this is where I want to shift how you see this. Your body is not failing you. It's trying to communicate with you. Those sensations, those changes, those subtle signs, they are signals, early signals. And the truth is, catching these signals now, before they progress, is one of the most powerful things you can do for your health. Because when you understand the pattern, you don't have to wait for things to get worse. You can step in early, protect your nerves, support your circulation, and in many cases, slow or even prevent the progression altogether. And that changes everything. Before we finish, I want to ask you something personally. Which of these signs stood out to you the most? Was it the tingling, the numbness, the dryness, or maybe something you've been noticing for a while but never really thought much about? If you feel comfortable, share it in the comments, even just a word or two, because when you say it out loud, or in this case, write it down, it becomes real. And more importantly, it helps others your age recognize that they're not alone in what they're experiencing. I read these comments and I can tell you, so many people are going through the same quiet changes, wondering if it's normal. And now you know. Sometimes it's not just aging, it's your body trying to get your attention. So tell me, which one have you noticed? As we come to the end of this, I want to leave you with something simple and reassuring. Your body is not working against you. It's working for you, even now. Every sensation you felt, every small change in your feet, is your body's way of trying to communicate, not confuse you. And the fact that you're here, listening, paying attention, that already puts you ahead of where many people are when they finally get answers. Because the truth is, when these signs are recognized early, you have time. Time to make small changes. Time to check what's happening beneath the surface. Time to protect your nerves, your circulation, and your independence. You are not powerless in this. Far from it. And if this video helped you see things more clearly, I'd encourage you to stay connected. Subscribe to the channel so you don't miss the guidance that can help you move better, feel stronger, and stay in control of your health as the years go on. And if you know someone, a spouse, a friend, a parent, who's been dealing with foot issues and brushing it off as just aging, consider sharing this with them. It might be the piece they've been missing. Take care of your feet, and you're taking care of your future. And that is always worth it.